Welcome to VHA Excellence in Healthcare with Dr. Carolyn Clancy, VHA Deputy Undersecretary for Health for Organizational Excellence, and Jacob Gadd, VHA-VSO Liaison. Today's edition, The Road to Excellence.
Hello, I'm Jacob Gadd, VHA-VSO Liaison. Joining me this morning is Dr. Carolyn Clancy, Deputy Undersecretary for Organizational Excellence. Good morning, Dr. Clancy.
Good morning.
Thank you for being here.
A pleasure.
So you're in charge of VHA's Office of Organizational Excellence. Tell us a little bit more about the office, when it was founded, and what some of your goals and priorities are.
So the office was formally established in early 2016, but the components are not new. What the office does is to bring all of these together so that we've got a consistent and very strong focus on making sure that veterans have timely access to safe, high-quality care wherever they seek our help. So that includes a focus on improving quality and safety, working with our colleagues in the field so that they understand how to assess their own performance and also test different approaches to improve that performance. It includes a very strong and exciting focus on sharing best practices, promoting health equity, and addressing the really important issues that are essential to restoring trust and public integrity in our system. So none of these functions are new. What's new is the integration and bringing these together for bigger impact.
Mm-hmm. And so when you say the word excellence, how do you define that in the VA system as well as a veteran?
So excellence sounds like a score you got. I got a A-, so that's excellent, or a B+. And really how we're thinking about excellence is it's what we do every day so that we're constantly looking for ways to improve and frankly ways to make it easier for the veterans we serve and for the people who are doing the work. That's a pretty tall order. But nonetheless, we're not going to rest because we're constantly looking for how to be better. And that's really what excellence is all about. Now, veterans have a huge role in this. Many of the veterans we serve have chronic illnesses, and effectively managing those conditions requires a strong partnership between the individual and the clinician or care team they're working with. Otherwise, it just can't be as successful.
Right.
So one example of that is something called the daily plan. Now, the daily plan is instituted in a large number of our facilities for every inpatient and will be spread across the entire system over the next year. And essentially, the care team and the veteran sit down together and go over what the plan is. The veteran can ask questions and then gets his or her own copy. So they're clearly part of the process. They understand it, they get it, they can ask questions. And sometimes they even remind us that maybe we forgot something like, "Doc, I thought I was getting an x-ray today." Right, you're getting an x-ray today.
Exactly.
So that when it's time to leave the hospital, that individual is in much better shape because they've understood the whole process. They're not listening to a lot of rapid information that sounds like, what? So we think that's hugely important. We also have terrific information for veterans on our website, a lot of detailed quantitative data, scorecards, and so forth, but also probably more important, hearing from other veterans. What does it mean to have diabetes, and so forth. This really puts the veteran in a terrific position when they're discharged, whether they're going home or to a skilled nursing facility or something like that. They know what they have to do because they've been engaged throughout the course of their treatment.
Yeah.
After all, it's about them.
It is, and it's so important as part of excellence to include veterans in such a plan, like a daily plan, because they're the ones that are ultimately getting the care, and this provides them the opportunity to be part of that treatment care team.
A really famous historical figure in medicine once said that good doctors treat the disease, and great doctors treat the person who has the disease. That's our goal in the Veterans Health Administration.
Great. Well, Dr. Clancy, I certainly have a much better sense of the office, and I really appreciate your time this morning and telling us about some of the great work that your office is doing.
My pleasure.
Thank you very much.
Join us for our next edition of VHA Excellence in Healthcare when our topic will be Sharing Best Practices. VHA Excellence in Healthcare is produced by the U.S. Department of Veterans Affairs.